Oh yeah, we just ready? Sorry, yeah, we just completed our First Minister's meeting with the Prime Minister and the premiers from coast to coast to coast here in the nation, where we had discussion on two topics. This morning we discussed the vaccine rollout. It was good to hear from Major General Fortin and to listen to the orders that he has put in and the reliability of supply that we have over the course of the first quarter, but also to understand the variability that is built into whether we could access potentially more vaccines, or even the variability in some of the supply chain that is there. So that was a productive morning. We're also, I think, encouraged to hear the Prime Minister has indicated that as far as the actual cost of the vaccines, the federal government will be covering that. The provinces will continue to cover the actual distribution and vaccination program for all Canadians respectively through the 10 provinces and 3 territories. So it is a cost share agreement that is much closer to 50-50 cost share than previous vaccination programs. This afternoon then we had a discussion on the Canada Health transfer, and to really have a discussion with the federal government about the opportunity that the federal government has to be an equitable partner in healthcare delivery across this nation. The Canada Healthcare transfer began in 1957 as a 50-50 partnership between the federal government and the provinces. It has since, through successive governments, slipped down to a level where I believe right now we are at about 22% federal funding of the costs of healthcare on average across the nation. What the provinces have asked is for that to be brought back to a 35%, for the federal share to be brought back to a 35% of healthcare funding costs. So it ultimately would be about a $28 billion annualized ask. We're disappointed with the progress that was made at this meeting with the Prime Minister specific to the ask that all 13 premiers had agreed to and put before him. But we are also encouraged that there was an acknowledgement that the federal government does need to do more when it comes to funding healthcare, specifically through the Canada Health transfer. And we were encouraged that and hopeful that the premiers and the Prime Minister will be able to again regroup at some point in the new year to discuss this very important topic. I think a topic that has been identified as being even more important, and that is the sustainability of our healthcare system across this nation, and the need for the federal government to ensure that they are stepping forward in this, what is a generational opportunity to become an equitable partner, or a more equitable partner, in delivering that health care to Canadians.
Why are you disappointed?
Disappointed in the progress of this meeting. The premiers have come together and put an offer on the table to the federal government, an offer to increase their funding level from about 22% to 35%. We're at about $42 billion a year is the current Canada Health transfer to the provinces. We've asked for that to be increased by $28 billion. And there was no discussion around where the federal government may land on that. We're hopeful that discussion could occur in the new year. But as I say, we were encouraged with respect to the openness of the Prime Minister in stating that this is an area where the federal government does need to have a look.
Did you go into this meeting thinking the Prime Minister was going to commit to the Premier's offer?
I think the offer is most certainly an offer that the federal government could commit to. We had put it in front of the Prime Minister and the federal government some time ago, and we were hopeful that we would have more progress at this meeting. And I think, in fairness, we were hopeful that we will have some progress in the new year.
How is this the right time for this kind of ask? I mean, the federal government is already dealing with a federal deficit that's nearly $400 billion. You criticized them before for being less fiscally prudent than government. Why are you asking them to take on further expense for an indefinite?
This is long-term sustainable funding for our healthcare services across the nation, and this doesn't even get the federal government back to the same level where the Canada Health transfer actually began. With respect to the one-time costs that the federal government has incurred due to COVID-19, and not to critique individual programs, but on a whole, the federal government, and I think the many provinces, Saskatchewan is is thankful that the federal government has stepped into an area and has done what they can to support workers, support jobs, and support Canadians in many ways here, not only in Saskatchewan but across the nation. That comes with a cost, a very large cost, as we've seen. And as I said, I'm not going to go into specific programs, but in general, the federal government has very much stepped into that space of supporting Canadians through this COVID pandemic, very serious pandemic, likely the generational challenge that we are seeing over the course of the last 20 or 30 years for sure. So that has created a deficit that they have, but those are also one-time costs that the federal government has. What we are talking about here today is ongoing, annualized, sustainable funding for our healthcare delivery system across the nation. And what we are talking about here today is not even going back to where the Canada Health Transfer began at that 50-50 cost share, but the offer that the premiers had put forward was to bring the federal government back to about a 35% partner in funding healthcare across this nation. We think that's a reasonable ask. We think it's an ask that is attainable by the federal government, and we're hopeful to pick up on these discussions in the new year.
Would you expect to accept 30%, 33%? What are you willing to go with? What would be reasonable for the province?
Well, the data that we have and the Conference Board of Canada work that has been done says that a 35% is a reasonable number for the federal government to look at. That is what we have put on the table. That's what we would accept at this point in time. We think it's reasonable that the federal government would consider that. And I would say that this is an opportunity for the federal government to really step into a space that successive governments, no government in particular, but successive federal governments have allowed to slip from time to time. If you look back historically through the CHT, about every 15 to 25 years, there is a time to reevaluate how the federal government is participating in that program. They did it in '77 with the exchange of tax points. They did it again in the early 2000s upon the subsequent Romano report that was provided, where there was a health accord that was assigned, where there was an escalator that was put in place for 10 years, a 6% escalator over the course of the next 10 years, and a fairly substantial cash injection that was provided in that year of 2004 as well. That's what we are asking for today, is that fiscal recalibration, or the fiscal recalibration of the federal government's participation in delivering health care across this nation.
Do you feel that the Prime Minister came to this meeting or wanted this meeting in a genuine way, or did you get the sense that he was doing this more to kind of humor the premiers because this is something you would ask for?
That would have to be a question that you'd ask the Prime Minister. I would hope that he would come to a meeting, and I think he would come to a meeting that when he is asked by all of the premiers, all 13 premiers, to come to a meeting with what is a very reasonable ask on the table for the federal government to correct a wrong that has been successively slipping over a number of decades, to correct in many ways that wrong, so that we can deliver health care sustainably over the course of the next decade or so.
If you didn't get what you wanted out of this meeting, what makes you think that the federal government is interested at all in the future of filling the offer?
Oh, certainly. I would hope that the federal government, and I truly believe that the federal government is interested in the sustainability of our healthcare delivery system across the nation that has evolved so very much over the course of the last number of decades. It began with doctors in hospitals, but has evolved far beyond that into long-term care, has evolved into the whole area of mental health care, has evolved into all sorts of occupational therapy and other various therapies that are offered in our communities, and the entire community services branch of healthcare. So it is a much larger system of delivery than it has ever been before, and I truly believe that the federal government does want to participate in discussions like this with the provinces, does want to work collaboratively with the provinces, in particular on a transfer, a historic transfer in this nation that has been there since 1957 through successive governments, and a historic transfer that has provided for the federal government to be a funding partner of delivering that health care in various provinces and territories, but B, also provides each region, whether it's a province or a territory across this nation, the flexibility to address some of the individual and maybe unique needs that they may have, whether that be an aging population, whether that be whatever that may be with respect to surgical wait times in their various areas of the nation. It's very important to have this transfer that is available so that the regions, the provinces, the territories in this nation can address the challenges that they have.
Just to clarify, on Adam's question, the premiers are not on the side.
Well, the offer is there, and you know, we were hopeful that the Prime Minister and the federal government will again re-engage early in the new year on you know, this discussion. But as we say, the facts that we had provided and the background information that the premiers have done say that the 35% offer that the provinces have put forward is a fair offer. It is one that the federal government can afford. And it's one that would provide long-term sustainability to our healthcare delivery system here across the nation from coast to coast to coast, and make it equitable. And it would ensure that it is there for not only this generation, but very much there for the next generation. That's why we have put the offer there, and we would hope, and I truly do believe that the Prime Minister will continue to engage on this.
Sustainable a few times during
Yeah.
this conversation. Do you feel as those Saskatchewan's health system is unsustainable if it were not to receive this?
Well, if you look at you know, present you know, increases that we're seeing from the Canada Health transfer in the neighborhood of, you know, 3 to 4%, 4.5% on some years, healthcare costs across the nation have been increasing at least that, and in many cases quite above that. If you go back to 2004, when the last fiscal recalibration occurred where the health accord was actually signed, there was a cash injection to correct some of the imbalance that we had at that point in time, and it corrected it by a number of percentage points where the federal government's share did increase up into that 22, 23, 24% area, and then 6% funding over the course of the next 10 years was part of that agreement. With that 6% annual escalator, the federal government share did not increase. It stayed in that 22, 23%, and I believe we're about 22% of our healthcare funding, healthcare expenses here in the province are covered through the Canada Health transfer now, which is common across the nation, give or take a few percent. So it is, healthcare has been a priority, I would say, over the course of the last number of years by this government. We have invested in infrastructure, we've invested in people, whether it be physicians, nurses, CCAs, most or continuing care assistants most recently. But I would also say that across this nation, we have seen, and COVID has exposed some of the challenges that we have in our healthcare system. They're different in different areas of the nation, but I would say that there has been some exposed, and I would say that this is an opportunity for the federal government to step in a very real way to become a funding partner, a more equitable funding partner with the provinces, so that the provinces can address whatever those concerns may be in our respective jurisdictions.
But do you fear that the aging population and the rising costs of healthcare equipment and treatments could actually bankrupt the province, and actually make it impossible for you to fund a suitable level of care for Saskatchewan?
Yeah, I don't think you could say it is impossible to fund. Right now, healthcare in Saskatchewan is about 42% of our budget. Other provinces are in a similar situation where it's between 40 and 44% of their budget. So it is a lion's share of the provincial budgets. This includes, with the current Canada Health transfer that we have. It's going to continue to be a priority, I know, not only for this government, if we continue to be government for the next however long in this province, that would be up to the people of the province. And I'm certain that it's going to continue to be a priority for other provinces as well. But the fact of the matter is if the federal government was to increase their share with respect to the numbers that we had been put before them, they do have additional fiscal capacity to fill this space. They do have the precipitous, when you look historically at the healthcare transfer, that they should strongly consider filling this space because they have traditionally, even back to the very outset of the program, and that's what we have asked collectively across this nation. Provinces deliver health care, but at its inception in 1957, we were 50-50 partners with the federal government, and what we are asking them to do is to move from where they are today, have slipped to 22% back up to 35%. We think it's a reasonable ask. We think that they have the fiscal capacity to do it, to participate, and we're asking them to do that on behalf of all Canadians.
What specifically did the Prime Minister say? I mean, if it wasn't an outright yes, what specifically did he say about the offer itself?
He said this is an area where the federal government, well, I'll quote the Prime Minister, just hold on here. The federal government needs to do more. And there was an acknowledgement that the the current federal government investment into the CHT and into healthcare delivery is not adequate. So that was the Prime Minister's words, and that is, I guess, what would leave premiers encouraged, that this is a discussion that most certainly we'll have the opportunity to pick up on in the new year and to work collaboratively at both levels of government, the provinces, the territories, as well as the federal government through the Prime Minister, to come to some type of a resolution. And potentially our hope would be that the Prime Minister would accept the offer that is been put before him, as we believe it's reasonable, we believe it's justified, and we believe it will protect the sustainability of our healthcare system for the next decade.
Regina, you learn anything new from the discussions about the vaccine rollout that might impact Saskatchewan as a plan?
The only thing, two things I would say. First of all was the costing of the drugs. I was committed that the federal government would be paying 100% of the actual cost of the vaccines, and then obviously the provinces will deliver those vaccines and pick up our share of the cost of the entire vaccination program. So that was new, and that is appreciated. And I think that sets a standard for maybe the future conversations around the Canada healthcare transfer, where the federal government can continue to be and can move into a place to be a larger funding partner of healthcare delivery. And so that was most certainly appreciated. The second piece I would say was with respect to the potential to receive the security of the flow of vaccines that we will over the course of the first quarter of the next year. And we're hopeful that that will be a secure flow on a week by week basis. And that's important for provinces to know, as we are ramping up and ramping down our actual human resources on the ground to deliver those vaccines and planning on where we're going to be delivering those vaccines on a week by week basis. So we had a good discussion with respect to the consistency of supply, or the rhythm of supply that we will get throughout that first quarter. The other conversation that we did have that was appreciated was with respect to, we have one vaccine that has now been approved, being the Pfizer vaccine. We have a second vaccine that is in that approval phase, and we're hoping they would be approved soon, which would be the Moderna vaccine, which would get us up to our vaccination targets that we have. Then we have two more vaccines that have now applied for the Canada Health for approval, and we're hopeful that if those two vaccines were approved, that would start to increase our numbers at some point in that first quarter. And we are ready to ramp up our phases immediately if we are able to actually access more vaccines from the federal government and more vaccines from other companies around the world. That's why we have went with this phased approach. It's flexible. It can ramp up, or hopefully not ramp down, but hopefully ramp up at any point in time, to ensure that as we receive the vaccines from the federal government, that we can get those out and make them available to the people of the province very quickly.
We have the average high for daily cases is up to 283. This is the most we've had. ICU admissions are up to all-time high. Why is it okay to wait a few more days to decide on extra measures? There's been 28 deaths since we started this.
Right. And with respect to well, let me start with this. The measures that we had put in place on November the 27th were fairly significant measures, and they do appear to be having some impact. Maybe haven't totally eliminated the rate of increase, but they most certainly have slowed the rate of increase. And when you compare where we are today to where the modeling had said we may be, we are in a much better situation. That being said, it appears to be stabilizing at much too high of a rate, a daily rate or a week-over-week rate, 7-day rolling average. So we have been in discussions as recently as a few hours ago, not myself, but the Minister of Health with Dr. Shahab, on how we should structure what we are going to do next week, receiving the advice from Dr. Shahab on exactly, what may need to be done next week, what may not need to be done next week, what needs to be done over the longer term, as we are going to have access to vaccines for our most vulnerable, our healthcare workers, at some point in time in the new year. But most certainly having that discussion this week and likely into the early days of next week on what moves, if any, we need to announce and move forward with on December the 17th, I believe. So that work is underway. It's underway by Dr. Shahab, our Minister of Health, and their respective teams, and we'll know more at some point next week.
Should people expect more measures coming in?
I think, Well, I won't speak. We'll find out exactly what that may or may not be next week. I think there's room for the discussion around, and I know that discussion is happening. Should there be some additional measures to slow this spread even a little bit more here in the province, given that we probably haven't seen the total impact of the significant measures that were put in place on November the 27th. So there is that discussion. Is there some ways to tweak the measures that are in place, maybe enhance them just a little bit to have some greater degree of effectiveness? That being said, I think I've always been out here numerous times and said there's really three directions for us to go on December the 17th. One would be to add some measures. Two would be the status quo. Three would be to actually relax some of those measures, which I was truly hopeful we would be able to do heading into the holiday season. As I said yesterday, that seems to be very improbable at this point in time, given where our numbers have been over the course of the last 7-day rolling averages. We probably are looking more towards, at the minimum, status quo, and likely even looking at some potential tweaking or some additions to those measures. That being said, back to the Christmas season or the holiday season, this will be a quiet time for us, and I would encourage families to start planning for a quiet time. What is hopefully nearing the end of a very long battle that we have all had personally and with our families and in our communities with this COVID-19 virus. The vaccine is on its way, but we do need to continue to do what we have been doing so effectively here in the province. We do need to very seriously consider over Christmas spending it with only our immediate household. Very, very different Christmas than maybe we had hoped for, and a very different Christmas than last year.
So is it fair to say that that status quo is also looking more improbable as we reach that 280 kind of record high 7-day average?
Dr. Shahab will have more on the specifics next week. I've provided a general outline on where we think we're going, and I think that really aligns with the fact that we have seen some significant success with the measures that were put in November 27th, understanding that that's less than 2 weeks ago that those measures were put in place, so there's likely some additional success that will be seen in the days ahead. But Dr. Shahab is looking at the numbers, the sources, everything very, very closely, and he is in the process of having those conversations on where we should go with the Minister of Health and their respective teams, and we'll look for something more official next week.
Thanks, everyone.
Thank you. You guys have a good weekend.